Well, first off, let me thank Lindy and Ben for inviting me up here, and to all their colleagues in the Australian Centre for Health Law Research. It's great to see such a vibrant group working in the field in which I work as well, and I've really enjoyed sharing stories and learning from them today. So today I'm talking about nudging for better health. I don't know if anyone's heard of this term. It's quite in vogue in the UK and the US at the moment. In terms of what I'm going to present on, I'm really going to provide a brief overview of some of the key ideas, key terms that have emerged within debates about nudging. And in doing so, I'm going to draw sort of a bit of a pick and mix from various academic disciplines and policy literatures across different jurisdictions. So I do appreciate, in the pursuit of interdisciplinary research, that different terms and ways of thinking apply in different ways in different disciplines, and different critiques can be offered. So please be kind to me as I wander through the nudge policy domain tonight and its application in health. I mean, that's what's so interesting to me about nudging in the health domain is the fact that it is very interdisciplinary. It draws on perspectives from ethics, policy, regulation, and economics, and particularly a subset of that, behavioural economics. I'm particularly interested in how the concept of nudge has been taken up at a political level, and I'm going to look at how that happened, particularly in the UK, and how it's being transplanted or transferred to the Australian context, and how this might impact upon policy and regulatory design and implementation, particularly in the healthcare context. One case study that I'm going to look at to perhaps critique nudge, look at its usefulness or otherwise, is in the context of organ donation. This has been used as a case study by the authors of the bestseller known as Nudge. I'll come to them in a moment. And I want to look at that particular case study, the situation in Australia, the research that's been done in the UK in the area using nudge strategies, and look at its viability and usefulness and the broader implications for using nudge strategies in the area of health. So I'll first have a look at some of the key ideas and concept in nudge. The whole idea of how something that had been developed within an academic context has translated and sort of captured the political imagination, particularly in the US and the UK, and more recently in Australia. I'll then move on to look at the case study in organ donation before concluding with some comments on the broader implications for using nudge in the healthcare context. So, nudge, where has it all come from? There was a book published in 2008 called Nudge, Improving Decisions about Health, Wealth and Happiness, and it became an international bestseller and was widely reviewed. Some of the comments were like, all the rage, it's hot stuff, an idea whose time has come, hugely influential. Every academic's dream is to get those sort of reviews beyond independent peer review in academic journals. Now, it was written by two academics, Richard Thaler, he's at the top there, and Cass Sunstein below. At the time, both academics based at the University of Chicago in the States. Sunstein's now at Harvard, with a detour working in the Obama administration for a number of years, and more of that later, and Richard Thaler is still at the University of Chicago. Now, within their respective fields, they are internationally renowned, and Thaler is a behavioural economist, and Sunstein is a lawyer, academic lawyer, who works and is very well known in the field of regulation and coming from the law and economics school. In fact, they're both prolifically published. Now, this book is sort of a popular or easily readable version of their academic work in the area, which had been going on for many years. And following publication, it did capture, particularly in the UK and the States, the public and, most importantly, the political imagination. And I'll go on to examine why that was so. So first off, how has nudge been defined by Thaler and Sunstein? It's described as an aspect of choice architecture that alters people's behaviour in a predictable way without forbidding any options or significantly changing their economic incentives. So what are some of the key ideas coming through this definition? The whole idea of choice architecture, what does that mean? I'll come to that in a moment. Working on changing people's behaviour. Their idea is changing it for the better. And there's a focus on the economic or market side of things, no doubt reflecting their academic backgrounds. In terms of the definition they provide, they add a number of caveats. Any intervention that may be classified as a nudge must be easy and cheap to avoid. For example, putting fruit at eye level might be considered a nudge if you're trying to get kids in the school cafeteria, to choose fruit over less healthy food. But banning junk food is not a nudge. They give lots of examples in the book, as I say, as well as case studies. So what are some other examples of nudge? Well, one that Richard Thaler has been working on for many years is looking at how we encourage savings over lifetimes. There's been a number of changes in private retirement plans, pension plans, that are putting more pressure on employees to make informed decisions about what they need to retire on and how they need to invest. And Thaler says, well, many human beings are ill-equipped for this task, so he suggests nudges, a number of nudges, to assist. For example, making it a default option that there is automatic enrolment in the States, this is, in savings plans. Otherwise, if you want to opt out, then you have to fill in a form. And secondly, with another collaborator, he's been working on what's called the Save Tomorrow program, which involves an automatic escalation of contributions from your pay packet in line with pay rises over time. Now, he describes it as a choice architecture system that's constructed by reference to a number of behavioural principles. The whole idea that, well, people want to save more, but they never quite follow through. They want to do it, but they don't have the self-control to organise something that will only have a benefit in the future and not now. And that people have an aversion or loss aversion. They hate to see their pay packets go down, and there's just a general problem with inertia, just not wanting to change. And we'll go through these behavioural principles a bit later on. Now, one of the more famous nudges that Thaler and Sunstein highlight is the old fly in the urinal at Schiphol Airport. Has anyone seen that one? Yeah? Well, I can only go by anecdote, but my husband's Dutch and he's actually done some empirical research and can confirm it does help with focus. And Dutch are very practical. So he said, yes, look, 80% spillage reduction. So there we are. That's described as a nudge. So there we are. Another nudge, another case study they look at is how we can encourage greater registrations on organ donation registers. There's often, there is a huge gap between supply and demand in the area, and they favour the use of defaults, or in particular, they favour a particular form of forced choosing known as mandated choice. And I'll come to that later in the presentation. Another one they mentioned, and I've spoken about where you position fruit or food generally when you're trying to encourage healthier eating options. And here we have Mr. Choice Architect here making decisions about putting fruit at eye level for Homer, and it's clearly having an impact. So that's another option. So this term, choice architecture, what does it mean? Well, they said it's very important that not only that we have choice architects, but that we get choice architecture right. So choice architects are those people that are responsible for organising the context or the environment in which people make decisions or can be nudged to make decisions. So if you're going to be a good choice architect and have very good choice architecture and bring about behavioural change for the better, they say it's important that choice architects understand behavioural processes in relation to human beings when they design their context. So the whole idea that context matters and that choice architects need to be informed about behaviour in terms of the context in which they work. So that's another sort of key idea within the nudge literature. So what are some of the examples of choice architects? Well, they quote the food services director in school cafeterias about designing where you put healthy food or not. Doctors in terms of encouraging their patients to perhaps lead a healthier lifestyle, perhaps setting up a context or a decision-making process in which that can happen. Teachers, students, basically a whole lot of us can be choice architects, but we need to be better informed about the context we're creating for changing behaviour. So now I do my brief Cook's tour through some of the insights from the behavioural sciences that have fed into policy making that has been described as nudge strategies. And again, Thaler and Sunstein provide this, and they draw on a range of other disciplines to do that, most notably cognitive psychology, but not that alone. But certainly behavioural economists have drawn heavily on the behavioural sciences in terms of their understanding of economic analysis and behaviour. So what are some of these key insights? The whole idea that we have two cognitive systems, there's different ways of describing it in the literature, two kinds of thinking, dual process theory, automatic system and reflective system, systems 1 and system 2. But what's the upshot of it? That we have an automatic system which is rapid, instinctive, uncontrolled, effortless, fast, unconscious, quite skilled in putting all sorts of associations together. The reflective system is described as controlled, more deliberate, deductive, self-aware, rule-following. Now, a lot of the earlier work in this area was done by a Nobel Memorial Prize winner in economics, a psychologist known as Daniel Kahneman, and he sort of brought a lot of his work together in a book known as Thinking Fast and Slow. Which is, and it looks at how these two systems work and interact with one another, amongst other things. And he looks at some of the experiments, the key experiments he's conducted over the years in the area, particularly with his collaborator Amos Tversky. And he looks at how these systems interact and work. And he's interested in cognitive biases, amongst other things. Now, Tversky and Kahneman identified 3 heuristics or rules of thumb, amongst other things, which they described as anchoring, availability and representativeness. And they looked at biases that may result as a result of using these heuristics. Their research program came to be known as the Heuristics and Biases Approach to the Study of Human Judgment. So let's look at what some of these biases are. 1, anchoring. So you start with some anchor, some base level, some number that you feel comfortable with, and you adjust in the direction in which you think it is appropriate. Now, once this anchoring process has happened, it may impact upon any perception of any adjustments you may make. Setting anchors in the context of public policy for Thaler and Sunstein can act as a nudge. The next heuristic that they highlight is what's called the availability heuristic. Now, most people assess the likelihood of risks by asking how readily examples come to mind. Now, if people can easily think of particular risks that affect them, they're far more likely to be frightened and concerned than if they cannot do so. So a risk that is familiar, in whatever context, will be seen as more serious than one that is not familiar. And this may help to explain risk-related behaviour, such as when people will be tempted to buy insurance for whatever reason. Unfortunately, in public policy terms, there may be biased assessments of risk, which can perversely influence how we respond to crises, for example, risk to public health. It may mean governments, for example, might allocate resources in a way that fits with people's fears rather than in response to more probability assessment of the actual level of danger. So there may be a need to nudge in the direction of true probabilities. Now, other sort of cognitive processes that are highlighted in the nudge literature is the whole idea that human beings, I don't think it's suffer from it, but enjoy unrealistic optimism and overconfidence. Yep, I'm going to finish that paper tomorrow. May not. Or that renovation, the builder's right, it will be done in 2 weeks, not 4 months. And so that's quite common. The whole idea of loss aversion. It's been suggested that losing something makes you twice as miserable as gaining the same thing makes you happy. So loss aversion can operate as a kind of cognitive nudge, pushing us not to make any changes although it may be very much in our interests. And then there's something called the status quo bias. And so loss aversion may not be the only reason for inertia in human beings. For lots of reasons, people have just a general tendency to stick with their current situation, and this is referred to as the status quo bias. It can happen even when the stakes are high or even when they're low. And another particular thing that's relevant for understanding public policy and the role of nudge is the importance of framing. Framing a particular problem in a certain way can have a huge impact upon how human beings, citizens respond to things. So it needs to be used with caution, according to Thaler and Sunstein. In summary, people may need a good nudge, it's argued, for choices, for example, that might have delayed effects. Those that are difficult, infrequent, or you're not getting a lot of feedback about. And those for perhaps where the decision you have to make or the choice you have to make and your experience of this issue is somewhat unknown or ambiguous. And this, again, may be particularly relevant to the health context, and I will come to that shortly. Now, I'm going to come to this in a moment, but there was a nudge unit in the UK, and they produced a document in 2010 known as Mindspace, bringing together a lot of these sort of behavioural theories and principles, and looked at how it might be useful for public policy. So they set out, building on some of these heuristics I've spoken about, the framing effect. We're heavily influenced by who communicates information to us. Our responses to incentives are shaped by predictable mental shortcuts, such as the desire to avoid losses. We're strongly influenced by norms, by what other people do. We like to go with the flow of preset options, might be why defaults and status quo bias defaults work. Our attention is drawn to what is novel and seems relevant to us. That can be a framing effect. Our acts are often influenced by subconscious cues. Our emotional associations can powerfully shape our actions, and then it goes on and on. So here we are moving into public policy here. How might it work? So that's another key idea I need you to hold on to. Another key idea that Thaler and Sunstein introduced is the idea of libertarian paternalism. And this is used as the principled or underpinning or rationale for nudge. How do they define it? As a relatively weak, soft and non-intrusive type of paternalism, because choices are not blocked, fenced off or significantly burdened. Our approach still counts as paternalistic because private and public choice architects are not merely trying to track or implement people's anticipated choices. Rather, they self-consciously are attempting to move people in directions that will make their lives better, i.e. they nudge. Now, this term has a much longer intellectual history than the book, Nudge. There is a fairly well-known paper authored by Thaler and Sunstein back in 2003 entitled "Libertarian Paternalism is Not an Oxymoron." So their justifications for the use of this term are rehearsed again in Nudge. Now they say, although these terms might seem at first blush contradictory, it does really affect, they argue, a common sense approach. The libertarian aspect of their nudge strategies is to be found in the view that people should be free to do what they like and to opt out of things they don't like if they want to do so. In short, people should be free to choose. And the aim of nudge policies is for them to be designed in such a way that this freedom of choice is maintained. So the term libertarian is used as a modifier on paternalism, and that it is legitimate for choice architects to try and influence people's behaviour in order to make their lives longer, healthier and better. So paternalism in this way is okay. So again, they advocate for freedom of choice. That doesn't make it too paternalistic or in an unjustifiable way. And they further add, as judged by the people themselves. So they put these riders on the terms with the view that this is a common sense approach to understanding nudge from a principled basis. They also say that in using libertarian paternalism, it offers a chance for political bipartisanship, because they're saying we don't want bigger government, we just want better governance. It's neither left nor right, as they would say, neither Democrat nor Republican. We'd say Conservative or Labor or Liberals or Labor, so depending where you come from. Bottom line is, though, academics have not been well impressed with the attempt to combine these, and there's been a fairly lively academic debate with people saying, in fact, it is a conceptual fudge, that in fact putting the two terms together is an oxymoron, end of story. That the problem, they haven't fully developed their notion of paternalism, that there are dangers relating to a slippery slope of unacceptable manipulation or coercion, and that for some people, paternalism is not justified in any shape or form as an infringement on autonomy or liberty. And I'll come to some more of that critique as we go along. Now, final thing that I need to highlight is behavioural economics. I've mentioned that before. For those of us who come from other disciplines, it's a strand of economic analysis that draws on research done by experimental psychologists. It challenges the whole classic economic model of analysis that takes as its starting point rational, self-interested individuals. So the research conducted by behavioural economists can highlight just how far the deviation can be in the case of human beings from homo economics. I'm going to say that, econs as they're known. So Thaler and Sunstein highlight this divergence in the distinction they draw in nudge between econs, as they call it, and humans. So econs are individuals that are offered by economists as a typical human being. They are rational, self-interested individuals who think and choose well all the time. They respond well to incentives. On the other hand, humans, they err. They make mistakes. They can be overly optimistic as to when they'll get projects done, and they may be influenced by a range of social, economic and environmental factors. So the question then becomes, as we move on, is taking all this together, why has it become so politically attractive? So that's what I'm moving on to in the next part of my paper, having done my Cook's tour through the some of the key terms. But just before we move on, is anyone aware of the National Bowel Cancer Screening Program? So I was interested to look, there was an editorial this week in the Medical Journal of Australia about it. And I was looking at this, both men and women not keen to be screened for bowel cancer. There's been a fairly low uptake, even though it's suggested that, it would be a good thing to do and it will save lives. The screening program at the moment is being rolled out to people within 50, 55, 60, 65 years of age, and they're sent DIY kits for bowel cancer screening. The editorial says that the uptake was unacceptably low at 33.5%. It goes on to identify GPs as being critical partners in increasing uptake. And we're looking at a screening program, it suggested it could prevent 70,000 bowel cancer deaths over the next 4 decades. So my question is, if you were a choice architect and knowing what you know now about behavioural principles, how would you nudge for greater uptake of the bowel screening program, bowel cancer screening program? Anyone got any ideas? Or is this editorial right on point? GPs really need to... What might be going on in the minds of people receiving DIY kits at home, do you think? Sorry? It's not like you're not going to get immediate gratification there, but the delayed effect is, well, it could save your life, I suppose, but you're feeding into a status quo or, that's not, I don't like that.
You have to keep it in the fridge.
Yeah, no, poo in the fridge. Yeah. You've got young kids, that could be a problem. Yeah, sorry.
I just thought it was very complicated. I mean, it was just so complicated. I mean, I'm not a medical person, and I suppose if I was a medical person, I wouldn't think, oh, it's straightforward. But I just thought, oh, do this, do this, do this, do this. Well, that's what the pathology people.
Because they're saying, well, breast cancer screening, good uptake there. And one of the interesting arguments made in Nudge is, too, is that, we've got to make it easy for people if we want to change in their behaviour. If it's very complicated like this, you're not getting any immediate gratification, the delayed effect down the track, the loss aversion, gee, I don't want cancer, I'm just going to put all that to the side. And the whole idea that maybe bowel motions aren't, something that people really want to deal with anyway. So it was just interesting in terms of how we might design public health screening, the extent, and I know in public health there's been a lot of work done on behavioural change and that sort of thing, but I find this an interesting example and looking at sort of theories in nudge and heuristic biases, etc., or cognitive biases, as to any other strategies that perhaps we could think about that might increase uptake. So I look forward to what might develop over time.
Excuse me.
Yes, sorry.
Could I just ask while we're on that screen?
Sure.
Actually, I was surprised at 33. I thought that was high.
I
agree with this man. I found it extremely complicated.
Yeah.
But was there any economic analysis done on how much the kits cost and the postage and God knows what else versus the return?
Yeah, good old cost-benefit analysis. Knowledge.
Do you know?
Well, I'm sure there is. I don't know if anyone else has come across. I haven't come across it myself. But again, they're all good issues to raise in terms of transaction costs. There is a cost involved in this. And if you're not getting the results you want,
Well, so on those statistics, 2/3 of the kits went in somebody's bin.
Yeah, 2/3. Do you need an intermediary? Do you need somebody who's going to make it easy for you, saying, here's the specimen, off you go. I'll take care of the fridge. I mean, do we need to make it easier for people to do something that's actually good for them in a way that makes it easy for them? We need to play into their, the fact that we're human beings and we have particular cognitive processes. If we're going to make public health screening work, particularly in this area, maybe some bit of nudging around the edges wouldn't go astray. Just something to think about. So I thought that was fairly topical and in a way of thinking about these sorts of principles and cognitive processes, you are struck by, no, that's not me. Oh, actually, maybe it is me. You do struggle with inertia. You do want immediate gratification. I will start dieting tomorrow. I must start running. And I do. So, particularly in the health area, it is complex. There may be things to learn, but it's a complex area, and I'll come to that in a moment. So, nudge as a political project. Again, just tracking what happened here. So what's interesting is that you've got conservative as well as, one describes more progressive political administrations both taking up nudge. You had Cass Sunstein being appointed as, now they're former colleagues from the University of Chicago Law School as well, but as what's known as Obama's regulatory czar, and amongst right-wing commentators in the States, such as Glenn Beck, he is known as the most dangerous man in America. Who would have thought that a regulatory scholar could have that title? We all dream about it, don't we? So, and Richard Thaler also met with David Cameron, and who's the UK British Prime Minister, and he also became enamoured with nudge as well. And he went on to become an unpaid advisor to the Conservative leader. And this led to the establishment of what's colloquially known as the nudge unit within the British PM's Cabinet Office. So we're seeing a move here from academia into the political domain, and we have the establishment of what's now known as the Behavioural Insights Unit. And it's spun off now from the UK Cabinet Office, and it has three owners: its employees, the UK government, and Nesta, which is the UK's leading innovation charity. And it's described on its website as the world's first government institution dedicated to the application of behavioural sciences. Interestingly, David Halpern, who's the CEO of BIT, was previously a senior advisor to Tony Blair. So what you see is it's sort of crossing the political divide here, which is what Thaler and Sunstein hoped. And David Halpern was also an academic and has gone into public policy and has a background in experimental psychology. They advocate a four-part methodology to identify what works, what can be scaled up, as well as what is less likely to be effective or not effective. So you've got to look at define your outcome, understand the context, build your behavioural insights, and test, learn, and adapt. So they developed a number of frameworks. I've mentioned the mind space framework earlier on about how to translate heuristics and cognitive biases into public policy and the design of public policy. They also developed what's known as the EAST framework, which is described as 4 simple ways to apply behavioural insights: easy, attractive, social, and timely. And they have a quote from the UK Minister for Government Policy, Oliver Letwin, and he's very much approving of the EAST framework. He says the behavioural science literature can be complex, so having a simple framework which policymakers can easily access and apply is invaluable. So it's interesting to see Nudge moving from academia into the political domain and how that is adapted in a public policy space to attract political support, and then to see, well, actually, how can it make, or how can it have an impact in terms of actual behavioural change. So a report back in 2010 known as the Mind Space Report, and I've been through that with you. Okay, more recently, members of BIT have begun work in Australia. So Rory Gallagher there on the left-hand side has set up now a behavioural insights unit within the Department of Premier and Cabinet in the New South Wales government. And so they ran a major conference, Behavioural Exchange in Sydney, bringing together stakeholders and policymakers to look at how this could work in the Australian context. David Halpern has now been appointed an international thought leader under the Victorian Government's Leading Thinkers Initiative, and he'll be focusing on a number of projects aligned with Vic Health, in particular attempting to use nudge strategies in the area of obesity. So there has been... Sorry, yes? 5 minutes. Oh, I've been home. Okay, so in a political level, what's not to like? The way the rhetoric is, it's low cost, low pain, avoidance, easy and cheap, less coercive, engages both public and private sectors, appeals across the political divide. They're very careful, they say, about how they will design policy in line with the mind space framework. Something that we need to question, though, and be critical of on the politics of nudge is that now, the private sector has used all sorts of nudges in the context of social marketing for years. We may have concerns about that. But do we hold governments to the political domain to a higher level? I would argue yes. In the context of democratic politics, we need to be transparent, we need to disclose, there needs to be accountability, particularly if there's some suggestion that we're relying on something less than rational thought, on subconscious cues. It raises the spectre of manipulation, which may be to the good, but there needs to be a justification and a principled basis for it. And it also engages with broader questions of legitimacy. Democratically elected governments need to ensure their legitimacy. They need to ensure that if they're going to take and undertake this sort of policy, that there is a strong enough evidence base, that it works, that it will be effective, and that they need to engage public trust and maintain that. And this needs to be kept in mind. So some of the critics of nudge, particularly on the principle basis, would argue, well, really, autonomy has the potential to be infringed here, and that's unacceptable. That because we may be subject to subconscious cues through nudging, our true interests will not be represented. There is a potential for manipulation, deception and coercion. They really can't justify paternalism in any shape or form. It can lead to infantilisation, to lesser acceptance of individual responsibility, and there really is a lack of transparency. Again, this is capable of another whole paper or two and presentation. I just wanted to highlight some of those criticisms. And also in the area of nudge and regulation, it's been presented politically speaking as nudge versus regulation. And depending on the political hue of governments who want a smaller state, citizens to really take greater responsibility, and that's particularly strong in the UK. Nudge is presented as an alternative to regulation. For those of us who work in the regulatory field, we just see nudge as part of the behavioural change toolbox, of which regulation is a part. So setting it up as a dichotomy is a false one. There is a place for regulation, I'd argue, and that's particularly important in the public health field. So I'll briefly look at organ donation and transplantation. We've got a very low rate of organ donation, comparatively speaking, in Australia, although it has increased significantly since there was institutional reform of processes around 2008-2009. But less than 1% of people die in hospital in the specific circumstances where organ donation is possible. So it can save many lives though. Even last year they had 391 organ donors, but it was possible to give their organs to over 1,000 transplant recipients. So that's just a breakdown of those figures. But at any given time, there are over 1,500 people on a waiting list for an organ transplant. So although Australia's deceased organ donation rate has risen, if you compare it to other countries, it is still quite low, and Spain is the world leader at 35.1 donors per million people. Compare that to Australia, 15.6. So the question has always been, do we need to devise a new default for organ donation to increase that? And one of the suggestions is that we adopt a different model to Australia, which is you've got to opt in to being an organ donor. Instead, you should say you will donate, you don't want to donate, you have to register your concerns. There's been a lot of ethical debate in medical ethics and medical law around that issue. But in come the nudge theorists. And they say, well, actually, if we just use defaults and we use a range of heuristic and rules of thumb, it may encourage people to sign up to the organ donation register. So we have a report recently produced by the Behavioural Insights team in the UK looking at using these different cognitive biases or different sort of approaches, drawing on behavioural ideas to encourage more people to sign up to the organ donation register. So after you've gone through signing up for your driver's licence in the UK, they use different prompts to see whether it would increase registrations on the organ donation register, because that's how you can do it online in the UK. What they found is that the most positive one that increased the rate of signing up to the register was what's known as reciprocity. It's like if you needed, if you need an organ transplant, would you like somebody to donate to you? Well, if so, why don't you donate to somebody else? And again, a lot of the different messages they were trying were around trying out, well, this many people lose their lives every day, that wasn't so great, showing different pictures to people about people being happy about having transplants, that didn't work so good, but encouraging good social norms and reciprocity worked well. But what these nudge policies might do, you might get more people on the register, but nudge or organ donation, transplantation, what are you looking for? You're looking for more successful transplants. And that's much more complex problem, a much more complex health problem. You need to take account of the decision-making context for deceased organ donation and the role of families towards the end of life. And often regulation has been used to set standards in these sorts of areas, so public trust in the organ donation and transplantation enterprise is maintained. So some concluding comments. What might this mean in terms of using nudges at a health level? Health is very highly visible in both the media and political context. So questions of legitimacy in terms of policy making and regulatory action are important. We need to know who will be the choice architects if we use nudge, what will be their evidence base. Questions of transparency and disclosure loom large. And we need to maintain public trust. Traditionally, regulation is one of those areas in which is used to maintain public trust, particularly in the health area. So we need to, I would argue, reconceptualise this false dichotomy between nudge and regulation as it's presented in the political literature, that it's part of a continuum, part of a spectrum, part of soft regulatory governance, part of the behavioural change toolbox, that we have many different options that we can adopt in the area. Yes, nudges may be appropriate, but we may need to move on to more appropriate or binding laws if that doesn't work, for example. So in what circumstances might regulation be appropriate, particularly in the public health context, where there's evidence nudge isn't working, where it's important that rules are known and visible. And this may be particularly important where there's power asymmetries, perhaps between the corporate sector and individual citizens over, for example, healthy food choices or a whole range of health choices in health. It may be important to facilitate compliance against a recalcitrant industry. And it may also empower government capacity to act. We may need to engage with regulation to protect from risk to public health, and again, using regulation as a tool to enhance legitimacy. So I'm beginning to think more widely in my research about the relationship between nudge, regulation and health. What I would say is that organ donation transplantation as a case study highlights the complexity of a particular public health problem. Yes, you do want to increase organ donation, but that's just the start in terms of success in terms of transplant. But behavioural insights are useful in the public policy domain. It can add to more informed public policy making. My view is that it's most likely to be successful in more small-scale, easy yes and no sort of situations. Its success in more complex public health areas, and of which there are many in the context of chronic disease, for example, is likely to be less successful. So nudge is a political project. There is much rhetoric, not a lot of evidence, a lot of potential in terms of bringing behaviour principles into public policy, but we need to proceed with caution. So we need to see it as part of the behavioural change toolbox. We need to question its capacity to produce long-lasting effects, that any attempt at presenting false dichotomies between the behaviour change full toolbox is not a good idea. And always remember that in the political context, in terms of engaging in something like nudge strategies, questions of legitimacy are likely to loom large, particularly in the context of public health, where public trust is important. Thank you.
Any questions in Anne-Maree?
Thank you. That was really fascinating. I guess, this is relatively new to me. So what strikes me is that this is a very old strategy, and that, supermarkets and other advertisers have been using this for a long time in simple ways like putting the chocolates where the toddlers can reach them, or, airing pizza ads during dinner time when you're hungry. And really what's new about this is actually using it for the purposes of good rather than evil.
I suppose you're making an assumption there that it would be used for good.
Well, I mean, that's the case studies that you've provided.
Yes, I think, and certainly Thaler and Sunstein saying their view is, yes, we want better outcomes. It's for the good. I think probably what's new about it too is the way in which you might bring behavioural sciences into the design of public policy and regulation in more proactive way than, and bringing insights in from, I suppose, behavioural economics, anthropology, so for a range of other disciplines that perhaps weren't to the fore as much. I think, though, that ideology has also played a role in the way in which it's been given prominence in different jurisdictions as well, in different ways. So I think that might be new. Do we expect more of government if they're going to do it in this way? Do we expect very little of the corporate or private sector?
I guess my question is, the private sector's been doing it
Oh, yeah.
choices.
Yeah, so what's... Yeah.
And no one's really ever questioned.
I don't mind if people put fruit first for me. It's good. Yeah, I suppose the question is, are we going to hold governments, though, to a different standard to the private sector? I don't know, what do you think?
I'd be happy, I guess, if they're well-intentioned and at least accountable in terms of, having to undergo some electoral process.
Yeah.
Advertisers and, manufacturers, commercial entities never have to actually undergo that.
Yes. Yeah. What about, I suppose, in terms of public health contexts like big tobacco or, the big ones that sort of grab a lot of the attention, or a whole range of public health issues where they feel like traditionally within public health there's a strong belief in the power of regulation to create capacity to regulate, perhaps when there's a difference in power between the corporate sector and, I don't know. So that's another area in which people have identified there could be potential problems. Yeah.
When you spoke about I can't remember his name,
Cass Sunstein, the most dangerous man in America, yes.
Because he was in regulation. That's what so the nudge is not regulation. So was it used in the Obama administration with a regulatory framework as well?
It's interesting, if you look at nudge, the popular version, it's appealing also to a very politically divided America, Tea Party sort of situation. And you can see it in their writings. They're trying to appeal across the divide and find a way forward. And when you've got the Tea Party and sort of more right-wing Republicans saying, we want no more regulation and we want a very small state, then the reason why they feel Cass Sunstein is the most dangerous man in America is because he's a regulatory scholar. He has been So they... it's a bit of fudge on their part in the sense that, they clearly do see a role for it, but they're trying to find a way through. And also, you've got to remember when this came out too, around the GFC, where austerity was what it was about. You need to do things cheaply, at very low cost. And it had appeal in that context as well. And they realised as well that across the political divide that, you had a major financial meltdown and it wasn't subject to rational self-interest in the market. It was, a whole range of... Yeah, sorry.
So I understand the concerns that you're raising.
Yeah.
But if you couple nudge with a regulatory background,
Yeah.
it's unproblematic in your
It is actually unproblematic. I don't find it problematic at all. I see it as part of a spectrum. I've done a lot of work in the EU context in terms of regulation. This would just be seen as new governance or soft law. It's dressed up, there's a lot of rhetoric around it, but essentially in the European Union, for example, known as a regulatory state, is you move from a range of options in the absence of consensus. You try and bring people together, and over time you may need to lead to regulation. The problem I have is just saying it's either or. And a lot of the policy documents, particularly at the start, and they'd acknowledge the people in the nudge unit, is presenting in that way because they need to appeal to particular political masters. So I get it. I don't know that we need to go along with it. Yeah.
Any other questions?
I think it's stupid asking this because I live in Spain. The Spanish organisation, are they opt-in or opt-out?
That's a good question. They're actually opt-out, presumed consent, and that was introduced in the late 70s. And they didn't see an actual... It's interesting, the economists do all these quantitative surveys and say, whoa, presumed consent works. But I ran a major research project on organ donation and transplantation in the UK, and we got the Spanish in. What made a difference in Spain was not presumed consent. It was okay, but they had major institutional reforms. And they had in-house donor coordinators who were intensive care doctors who worked with families. And they put an incentive system in the hospitals. So it was a lot of institutional reform that made a huge difference to their rate. And certainly the UK Organ Donation Task Force looked at the Spanish model and said, it's not just about presumed consent. There's a whole range of, it's much more complex than that. And they're going down the institutional reform route, and they have not advocated as yet for presumed consent. So it's very interesting, yeah. So I think you need it's a whole range of reform issues to really bring about a change in organ donation rates. Yeah.
Just a comment. I was thinking about the obesity.
Yeah.
It's another bit tricky. And how much is nudge a deliberate strategy that's one up on being intuitive about you how you might do it? Is that I mean, there are all these deliberate things that you've looked at, heuristics and bias
Mm-mm.
and things like that. But then you look at obesity where we're failing miserably. And so how is it going to be married?
I think that is the big question. And, a lot of the initiatives that the BIT people are attempting to run in Australia are going to be focused on obesity, given the nature of the problem in Australia. But, if you read the public health literature, there's a lot of work that has been done on behavioural change to deal with healthy eating and obesity. This is not new. A lot of our public health people say, we're reinventing the wheel here. I think it is a very complex problem. And the whole idea that nudge is the solution, I think, is disingenuous. I think it should feed into how you think about public policy and how you design things, but this is a very complex problem. It's going to need a combination of regulation, of nudge, but the whole idea as people face, and also the way in which we design the contexts and eating environments, it's very hard to resist all those super-size me items in the supermarket. I wouldn't be alone. So yes, there's no easy solution. And I don't think Nudge has got it, but it's not to dismiss it, but it's just, the rhetoric is very, shall we say, very high. But you're looking at generations of public health research looking at it as well, and it's not going to be cured overnight, that's for sure.
Probably got time for one more question.
I was just curious whether you actually, going back to your question to us before, whether you actually had any ideas around nudge or choice architecture for the colorectal cancer program from the Cancer Council.
I'd be interested to know, I'd be fascinated to know the background to why that decision was taken, though, and why they thought there would be a good uptake, or they didn't, or they...
Oh, well, a program like that is, obviously has to conform to the World Health Organisation's criteria for a population screening program. That's a pretty rigorous set of criteria, which includes things like acceptability, feasibility, economic viability, and also...
So there was a cost-benefit analysis done? Yeah.
Oh, absolutely.
Okay.
Absolutely. And really, there are very few medical tests that actually pass that set of criteria, which is why
Wow.
we have so few population screening programs available to us. In fact, really, there's only 3, and it's cervical screening, breast screening, and colorectal screening. So for a test to be chosen, it has to conform to all of this great stuff. And, from where I sit, it's incredibly disappointing to me that, there's 3 possible population screening programs that are viable, tick, 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 and you whack it out there and only 30% of people, for very valid reasons. I understand all of the issues around distaste and all of that. But I would be fascinated to know what the behavioural scientists think about the ability to change some of that in the population. Because then we have a really good story.
Well, it's interesting what they would probably say. They're very much in favour of their random controlled trials, is that before you send out all the screening kits, did you do a trial? Did you do a test?
There
Yeah.
are many randomised controlled
And so
trials.
what did that show? That was...
It shows that if you have the right level of participation, which I think from memory has to be around the 60 to 70% mark, that you will reduce death and there will be benefit to their health.
So how do you assess this? So why is there, if you've done that, did you have that sort of response rate and so you send it out? Or because there's a huge gap there between 33.5% and 60.
Yeah, no, there
It
is.
was the last, Bowel was the last one to be introduced, so breast screening,
Yeah.
cervical screening have been in longer too.
Yeah.
That it's more sort of accepted and known.
Yes. Because they're saying education is an issue, and that so the behaviouralists will say, yeah, that's important, but how are you going to get over these, cognitive biases of like, I just don't have to deal with this, or it's very complex? Because that's what Thaler and Sunstein do emphasise in a lot of literature, is make it easy for people to the point that they cannot not do it. The one-click technology, of course, it's not possible without, but the whole idea that look, I don't want to die of bowel cancer, but I can put that off in the future, can't I? So I totally accept the WHO stuff, and that seems very rigorous and good. But is there some tweaking around the edges that really might make a difference? I mean, in terms of their messages on organ donation, they've had thousands more sign up with a different message. Now, whether that translates into successful transplant outcomes is a whole other question. But if you're just trying to get that screening done, And you can fully accepting who, but is there needs some tinkering around the edges and maybe nudge or behavioural principles in some shape or form. I'm not an expert in the area, might be worth thinking about. People at the Cancer Council have been doing behavioural stuff for a long time. Yes, exactly. So I don't want to, tell you what to do at all, but it's just worth thinking about. And I do, but what you raise is so fascinating to me in terms of public policy design and with the best of intentions. And even they said in their organ donation study, they had a lot of things they've had some findings that were counterintuitive, where they thought it would work, showing a picture with a message that's easy, visual. They had a drop. So it's playing around with that, and I think we've all got stuff to learn about it. I'm looking on with interest, shall I say?
Anne-Maree, that was very, very informative and interesting. Thanks for engaging.
Thank you.
And I'm sure